Hey everybody, it's Kevin and Zane from RPH Ally. This episode is sponsored by Digital Thoughts, all things coming from Zane's big brain and illuminating the rest of us. Today, this episode is all about SDOH, social determinants of health, and how it's just not another acronym in healthcare and we can't treat it that way. So why you need to stay tuned to the rest of the episode is really to learn what does it mean. Zane's going to break it down for us on what that actually means and how it impacts the way that we leverage technology and healthcare kind of moving forward. We'll see you after the clip. All right, brother. You were just telling me I do not have it memorized, but I know that you're writing an article and working on an article, which I'm really excited to read on social determinants of health. But for those that might not know, Zane, like what is it? Like define it and kind of help us understand it overall.
Yeah, so I'm going to just read off a definition from health.gov. So they define social determinants of health as are the conditions in the environments where people are born, live, learn, work, play, worship, and age that age that affect a wide range of health functionings, and quality of outcome and risks. Sorry, guys, I cannot read. I'm sorry, but basically, what it breaks down to is 5 separate categories. You have economic stability, education access and quality, healthcare access and quality, neighborhoods and built neighborhood and environment, and then you're also your social and community. So healthcare really is only one slice of the pie, and that's one thing that I think a lot of people forget about social terms of health is there's more to it than healthcare, and we really need a policy push towards this. It can't just be, hey, let's get them access to healthcare. We're helping social determinants of health. That's not all of it, right? Because once, let's say we get them access to healthcare, they don't have the right education. They don't have the environment that they live in is not conducive to a healthy output, right? Either they don't have the right kind of food and things. So we're not really helping them in terms of social terms of health. So that's like something that I think a lot of people don't know about SDOH.
That's super helpful, buddy. So when you've been writing this article, let's dive into that a little bit. You've told me that you have put out a ton of articles in between pushing this one out. Why is that, bud? Like what feels like the reason why this one is one that I'm just going to phrase it the way I'm thinking of it, but you please change it. I think it's special to you. And so you really want to give it justice, but I guess tell folks more about, why we're talking about this subject and why that article is still to come.
Yeah, because I want to. It's a pretty big topic, and I don't want to. If people have read like my other articles, or a lot of my articles, I won't lie, I write like the night before. I have the ideas beforehand, and I like go based on my own, what I've seen, what I've felt, and I kind of write that based on my experience, right? Thankfully, I'm blessed enough to not experience a lot of this, right? I've seen people that kind of meet the criteria, so I can talk about it kind of from an emotional state, but I also want to bring some numbers behind it as well. And it's something that I want to really give the care that it needs, because it's such an important topic that really I think is misunderstood sometimes, and I don't want to add to the noise of what's already out there.
Makes so much sense. How do you feel like, Zane, right now in the current status? I mean, right now there's some very interesting things happening economically with the startup kind of world, with those that are going into health tech ventures, I guess in general. But when you've seen the words social determinants of health utilized in the space, you're telling me when we're off camera, there's two kind of different ways that it can be used, and we can use it for good with one side of it. And I guess how do we do it, Zane? Maybe that's what my overarching question is. If we're just using SDOH to be able to plug that in, that we quote unquote care about that, versus we're actually doing things to help those communities. How do we make sure the technology is following down that funnel of truly helping and making a difference there and connecting with those that may have less advantages?
Yeah, I mean it's about creating a whole ecosystem for everyone, right? So, I mean, we can't you can't have one startup attack every single thing, right? So what we really need is we need basically policy, right? Public health policies to help us with this. And that's one thing that is lacking. And a lot of people are so focused on, hey, you're not healthy because you don't have access to healthcare. Okay, let's get them access to healthcare. One, that's not always what's making them healthy, right? It's the foods they eat, the environment that they live in. Is it pollution, not polluted? Do they have access to schools? Do they have access to good schools? How are they being taught what they're being taught? I mean, I think the statistic is, I can't remember off the top of my head, but more than 50% in the United States reads at a 7th grade level or less. So, I mean, that's another thing, right? That pops up a lot in healthcare. So we really need to attack it from like a multi-pronged approach, and we really need help. Not just, we can't just focus solely on healthcare and healthcare access. It's a lot bigger than that, right? I mean, one of the examples that they give is, the people that you interact with on a day-to-day basis, your community, the crime that you're obviously, areas that have more crime, higher crime, have a lower life expectancy rate, just for the sheer fact of, gun violence or overdoses or whatever it may be. In some, there was another Times article, I can't remember how long ago it was. They were looking at how zip codes affect healthcare, and they were looking at Chicago, like Chicago suburbs, and I think it was almost 10 years difference between two zip codes that were like almost right next to each other. So can you imagine a
Wow.
zip code maybe one or two things, one or two away from you, having a 10-year less life expectancy just because of the 5-digit number? And that's kind of what is social determinants of health.
Yeah, I'll come at it, Bud, from like an optic standpoint. Just from the different communities that I've lived in or areas that I've been. Like I've been as I'm a rural guy. Like that's where I was kind of born and raised. But when it comes to access, I was talking with a Native American wildlife biology leader the other day, and him and I were talking about nutrition, Zane, and like nutritional aspects of care and going toward like healthy living and lifestyles. And the conversation wound into a very interesting way, because for me it was, what are kind of cultural aspects of health and what were traditionally being eaten or consumed by indigenous individuals, and trying to bring those cultural aspects back, because I've seen that through IHS and through tribal outreaches that, we're bringing in more salmon and utilizing more bison to be able to give back to tribal members that have, lower fat content, higher omega-3s, just overall health benefits. It did not go that way. Basically what this individual told me, and I would say his name, but he didn't give me permission here. So shout out to you if you hear this, buddy. But he said, Kevin, if you come to my reservation, there is nowhere to get healthy food. It doesn't matter what kind you want it to be. Like we don't have a healthy food option. So if you are developing applications for eating healthy food, finding healthy food in your neighborhood, ways to cook healthy food, big gap there when you can't actually get it in the area you're in. And the exact same thing that you and I have talked about before, Zane, when it comes to high like internet leveraging. We're trying to use Wi-Fi. I don't know about you, buddy, for your parents or your extended family, but at least for me, like just getting them onto their phone for the first time is a Herculean effort, let alone getting them connected and reconnected to their Wi-Fi, dropping on and dropping off. Like all of those things are relatively painful, and I have direct access to them, let alone the healthcare market saying we're going to spread all of these devices and all this technology across these systems and across individuals that may not have that kind of, let's just call it, technology background to be able to know how to troubleshoot and deal with the issues that we know we're going to face on a regular basis. And so I think that is a real testament to why, when I've talked to a lot of the companies that are out there, they have not only preferred, but they've basically shut the door on Bluetooth devices in lots of ways. Not to say that's always the case, but they have, because cellular devices just give them so much more ability to stay connected and not have to go through these troubleshooting issues, which I think once again speaks toward, those 5 elements we were talking about, being able to serve those communities with a greater deal of ease. Anyway, wanted to take the conversation and kind of move it over to you, Zane, on this question. There's a lot of companies out there right now that are going and serving these communities. I mean, I guess I won't plug or do any name drops right now, but they're basically having mobile units. They're having mobile units now go out in these communities and provide, additional assistance. And these are in all types of communities, not just rural. They could be inner city communities. They could be based on a cultural or other, ethnic background. They could be based on socioeconomic statuses. but they're going out there and they're either connected to payers or they're connected to like, clinical systems that are working with those payers in a value-based care kind of atmosphere. Do you see some of those, Zane, like with that, I don't know if boots on the ground is right, or grassroots, however you want to say it, like with that really connecting to the community by being there? Is that the next step in healthcare? I mean, we talked the other day about hybrid care, but I think this plays in really well there. I'd love to hear your thoughts.
Yeah, no, 100%. There was a person I talked to, I can't think of their name right now, but they're creating a caregiver first platform where it takes care of caregivers that, help them take care of their patients, right? Like for older patients, be able to deliver meals to them, get them all that, be able to take them to and from appointments, work on other social services for them through their app, right? They're connected with a lot of different things. And that's kind of what we need. And there are people thinking like that, and it's amazing. And it really makes me happy because our health is a little bit more than just going to see your PCP once a year or going to the emergency room when you have the flu. To answer your question, yes, there are people doing it, and it makes me happy, right? And that's kind of what we need. We need like a whole, everyone just trying to like make it better, because things are like, I think everything falls on the healthcare system to keep people healthy. And if we keep thinking that way, it's just, we're never going to have a healthy society. Like CMS has this very famous thing that everyone knows that's ever worked in a hospital, 30-day readmission, right? And I understand why they're doing it, but I've seen 30-day readmissions that are for things that are completely out of our control. You can do everything right in the hospital. They don't pick up their medication. Guess what? They're going to come back for the same thing. Then the hospital gets dinged, right? I'm not saying it's right or wrong, but it is the reality of life, right? They take the medication wrong, or they just, I've talked to patients where I call them a couple of days later and you're like, hey, did you pick up the antibiotic? Oh, no, I haven't had the chance, because they had to go back to work, right? They don't have PTO. Like, these are things that people are really living with, and they have other stresses that are happening around their life that are outside of just their health, that is making their health worse. And that's kind of what social terms of health is, right? Is looking at what your health is at a much broader, like 30,000 foot level. Like, hey, what is making us unhealthy? What is making us healthy, right? Generally speaking, the more like if you live in areas that are a little bit more affluent, you're going to have access to grocery stores, hospitals, better education, better communities, better, in this case, they talk about religious area, like, community centers and things that exist, like, for example, the city that I live in, there used to be a bunch of grocery stores throughout the whole city. What happened was, I live in one corner of the city and the lake is on the other side. That's really only places where grocery stores are now. The whole center of the city almost has no grocery stores. So kind of to your point, say you're really busy working 2 to 3 jobs, the closest grocery store is a half an hour away, 45 minutes away from you. What are you going to do? Are you going to go to the grocery store, try to pick up something, try to make some food for your kids, or are you just going to stop at the local McDonald's or KFC or whatever it is? And we shouldn't be judging these people for that. What we should be doing is, hey, how can we help them better, right? And that's what is happening. I mean, that's just in the city that I live in.
Wow. Yeah, I think that's the charge, really, is just when we're creating things, thinking about these disparities and being able to correct them with what we're trying to build. I mean, just to paint one last picture for the audience, I know that I have talked to payer organizations or value-based care organizations that have literally told me this, Zane. Their executives have told me, I would personally, like how much money they end up costing us, I would personally go and drive this person to their appointments, send them food, connect the dots for them for lunch, pick up their groceries. Like if that is how much it is being cost on the back end for people not being able to fulfill their obligations of care, right? Then being able to focus on that on the front end and deliver solutions that are able to address that, I think is a great opportunity for us to be able to say, here's ways we can help individuals that are likely to be able to slip down the slope of healthcare, because we know that unless you have help, unless you have above 7th grade reading level, as you mentioned, unless you have a lot of these other things going, the likelihood that these folks will be more expensive for the healthcare system is higher. And so there's the win on both sides, to do it altruistically and to be able to tie the financial dots. But I wanted to, leave the last thoughts for you, bud.
No, 100%. And we have to do it in a way where it's one thing about technology, right? It's usually people like you and I that are more in the upper brackets of salaries and affluency. And I won't put words in your mouth. Let's just say me. It's people like me that can take advantage of it. And I don't really necessarily need it, right? So we need to come up with a way to do these kind of do these kind of things and make it affordable for the people that actually need it, right? Let's not do what, hey, let's put it out in like these really big cities that we know we can afford it. I understand there's an economy of scale to technology, 100%, but we need to do better by these people because they need help. And a lot of times you talk to these people that just don't know how to get things done because their life is much different than mine. And the things that I worry about, like waking up on time for this interview. But they're dealing with real things, right? So I've talked to, I remember a person I worked with, she worked 2 jobs and, had to drop her kids off in the morning because the bus wouldn't come to their neighborhood. So they had to drop, so she would always be late and always get reprimanded. But thankfully the place I worked for, were like, hey, it's okay. They understood, but not every place of work is like that. How many people have you talked to that have been fired for doing the basic things for their family because they have no other options?
Yeah, entirely. I think there's some inspiring stories of healthcare providers out there that are trying to go the extra mile to help people with those things that they struggle with. I think, me helping a family member with a FAFSA form or how do I get this documentation put in is a very common thing, on kids trying to go to college, which is a real blessing to be thinking about those things. But how do I fill out this insurance form? How do I afford my medications? All of the elements in healthcare that they provide some very significant barriers that sometimes we don't see or we don't acknowledge maybe. And I think this is a wonderful opportunity for those out there that are trying to make change to be able to recognize the huge impacts they can truly make on society by opening their eyes a little bit further and seeing some of the folks that they really need their help.
100%.
Love it, man. Great episode, everybody. Hope you're going out there and making incredible changes for your communities. I know that Zane and I are trying to do our very small parts in what we're doing to do so. And we look forward to hearing your guys' stories about what you're doing in that space. Tune in for another exciting episode of the Health Care Tech Show next week. Have a great one.
Bye, guys.